Obstructive sleep apnea in children. So, I have dealt this topic in 5 different parts. In the first part, I have given a small introduction. What do you mean by sleep apnea? Few important terminologies, and what are the common causes? How do you classify sleep apnea? And how do you grade sleep apnea? Mild, moderate, severe, all that. That is part 1. Part 2, I have dealt with the main complaint from the patient side, that mainly from the mother, and the doctor examination findings. In part 3, I have told you about the investigation. In this part 4, I am going to tell you about the complications related to sleep apnea. There are so many complications related to this condition. To start with, let me tell you the developmental and behavioral problems. So, all these complications, the child develops only if the condition has not been taken care and he has been having this condition for a prolonged time. Now, there will be developmental delay, and if it goes on for a long time, there will be a failure to thrive, and the height will be short, he will be short statured. And if the child has got adenoid hypertrophy, adenoid is a tissue which is seen just behind the nose in the nasopharynx, and this complaint is there for a long time. Even the facial muscles and the facial bones, it doesn't grow normally, and the child will get a long face. Maybe the parents, father and mother, they have a round face. The child, he or she will get a long face in adenoid. Even the face can change. That's what I mean to say. And now the behavioral changes will be there. He'll be irritative. He'll be short-tempered. He'll become very aggressive, and in short, he'll have so many personality changes also. Is this, can sleep apnea lead to cardiac complication? Of course, yes. I'll tell you the reason for that. Because normally, when a normal person or child sleeps, all the body organs sleeps except brain and eye. So, the heart rate comes down to the least. The normal heart rate being 60 to 80. So, it comes down to the least. It becomes like 50s, and it stays in 50s range for the whole night. But in a case of sleep apnea, what happens is it drops below 60, below 50, say around 40, and suddenly it jumps to above 100. So, there is wide range of fluctuation in heart rate. It comes down, bradycardia, then jumps up, tachycardia. The whole night there are at least we have so many different times you have this fluctuation. So, that is not normal. So, what happens because of this? The child can get systemic hypertension, nocturnal diastolic pressure, or even arrhythmias can be, and the most common being pulmonary hypertension. Not only that, the child can have lung related problems. Just like the lung respiratory rate, which is normal, comes to about 16 to 18 to 20, it comes down a bit. It has to come down during sleep. So, what happens in the case of sleep apnea? It comes down, the respiration stops. That's what I have already mentioned in part 1, which is called as apnea. So, respiration stops. Then suddenly it becomes more than unusual. So, there is wide fluctuation of respiratory rate also. So, this gives rise to some changes in the tissues in the body, in the lungs and the body framework also. So, the child can get repetitive airway infection too. So, gastrointestinal tract changes, he refuses to eat, and if suppose the child has got acidity, it will increase, and whenever he eats, he shows a feeling of nausea. Sometimes they do vomit too. So, what are the neurological problems? So, main problem being, the cause for this, the oxygen level in the body is less, and what happened the same time the carbon dioxide level goes up. So, when this problem has been left alone for a long time without treatment, the child gets up in the morning with a complaint of headache. And like how I have mentioned previously, slowly a normal child who was very calm, he slowly becomes aggressive, hyperactive, he becomes impulse, and his learning ability decreases, and his mood swings a lot, and in short, his quality of life goes down a lot. Now, if suppose such a child is being subjected to any other surgery for any other cause, so what happens during anesthesia? Such a child with sleep apnea, there is a high possibility of respiratory complication, cardiac complication, and of course, it prolongs the hospital stay too. Now the dental related causes are bruxism, where he bites his teeth during sleep. And just like how I have mentioned before, his facial bones development will be different, and the whole teeth arrangement misalignment will be there. It will be cross bite also, and there will be so many other orthodontic problems also, inclusive TMJ problems. So these are the complications related to sleep apnea, and he will be tired in the day, fatigued, and suppose the child has got a sleepwalk habit, which is called as somnambulism. At the same time, he had got sleep apnea also. Maybe the sleep walk disturbance may increase. So these are the common complications related to sleep apnea. So the point is, if suppose you have sleep related disorder, obstructive obstructive sleep apnea, if it is neglected, it can result to all this, and some of the complications, as you see, it takes a long time to revert it to normal. Suppose you diagnose it early and you relieve the obstruction, it will go back to normal and of its own at the earliest. So please do not neglect. That's why I detail about the complications so much. Thank you so much.